when you have both knees done at the same time or both knees replaced at the same time, one of the biggest questions is, how do I pick something up from the floor if both my knees are still recovering? Both of your knees might still be inflamed, they might still be in a little pain, you might still have limited range of motion. I created a video, so check out my channel on how to pick something up from the floor if you had one knee replacement. Now, this is how you will do it if both knees are done at the same time. Now, let's say I have a small kettlebell here, and this is what I'm going to pick up. I'm going to turn on my side so that you can see it. What you will have to do first is you have to have a wider stance. Why is it important for you to have a wider stance? And let me explain. Because if you have a shorter stance like this or a narrower stance, to be able to get down to the floor, you will need to bend your knees more. So that means that you will have that, you will need more knee flexion. With knee replacements, that can be an issue with some patients or with some people. If that is your issue, then having a narrower base of support or a narrower stance will not be ideal for you. But even if you do have good knee range of motion, good knee flexion, I would still have you do a wider stance, because when you have a wider stance, you actually will need less. So when I do this wider stance, you'll need less knee flexion, right, to be able to go down to the floor, because when you stick your butt out, you can actually lean forward. You'll have this gap in between your legs here that you'll be able to go down and grab the object. So you won't need as much flexion compared to if you have narrower. I won't have that space here, so I will have to go down further. If it's a wider stance, you can bend your hips more, so you actually will not need as much knee flexion and be able to pick things up from the floor. So for you, if you have bilateral knees done at the same time, the key thing is you have to do a wider stance. It's similar to doing a sumo squat. When you do this, stick your butt out, and then keep your back straight to protect your back, but you're going to bend forward and pick that thing up from the floor. So in this case, you have to do this and do it safely, right? Stick the butt out, bend your hips more so that you don't have to bend from the knee as much. Keep your back straight to protect your back, keep your stomach tucked in. But overall, the most important part there is you need less knee flexion, and you're using your glutes more, you'll be able to get up. And with less knee flexion, you won't have as much of a harder time bending down to reach the floor, to reach the object on the floor. Now, if you don't have enough space to assume that wide stance to pick something up from the floor, this is what I would want you to do. This is similar to the technique that you will use if you have one knee replacement. So the most important part here is you will have to pick which is your stronger leg. When you have both knees done at the same time, most commonly one leg will be stronger than the other, or one leg will be progressing better than the other. It's not uncommon that that happens when you have bilateral knee replacements. They conducted studies before trying to explain why, and they actually could not find why that such is the case. They did studies with the same person. They tried to do the same prostheses as close to the same condition of the knee before the surgery, and try to control everything, and still in those subjects, one is better than the other. One will have more scarring, the other one will have less, one will have more inflammation, one will have less. They really cannot explain why. So in this situation, how it applies to you is you are going to pick which one is your better leg or which one is your stronger leg. It can be your dominant side also. If that's your dominant side is progressing better, then you can pick that leg. Now, let's say for example, in this case, for me, it's my left leg. So if my left leg is the one that's my stronger leg, what I would want to do to pick this up from the floor is I would put this forward, put my other knee back. Now, always remember, I had both knees done at the same time, okay? So if this one is the stronger leg, put this forward, this one back, and you're just going to bend down. Most of my weight will be supported by my better leg. The other one will be mostly for balance. Okay, so you're going to bend down, just try, and then that's where you pick something up. All right, so you're going to be on one leg. As you can see, this one doesn't need as much space. The other one, when you assume a wide stance or a sumo squat, that requires a lot more space. And this one, even if it's more limited, you can actually bring both the legs even closer together. You do that. If you cannot actually do both knees going down like this, because it's more difficult, and let's say, for example, one knee does not allow you to bend like that. So just go like this and then pick it up from the floor, and then now you have it. There you have it. You have two ways on how to pick something up from the floor when you have both knees replaced. It all depends on your condition, depends on your surroundings, depending on the space that you have, if one is more appropriate than the other. Let me know in the comments below. Are they both doable for you? Do you have a preference of one over the other? I would love to know. Thank you very much for your time. Thank you very much for watching this video. I hope this video is helpful to you, because picking up something from the floor is very common, and this is something that we do all the time. And having a knee replacement should not be an obstacle, should not prevent you from being able to do that activity. And please share this with someone you love so it can help them be able to do that necessary activity also comfortably if they had both knees replaced. Again, don't forget, subscribe, click on that subscribe button and turn on your notification, because we release new videos every week so that you can get alerted once our new videos come up. Thank you very much, and I appreciate you.